Hi, my name is Nyasha Banderson, and welcome to Pendulum in Conversation. Today, we're going to be discussing about breast cancer. Given that it's Breast Cancer Awareness Month, I think this is an important conversation to have, and today we've got an amazing panel of speakers. So first of all, we've got Dr. ZIMBABWE, a renowned oncologist, I think known for her work in the industry for quite a number of years. We've also got Dr. Mashawe, who's also going to give us a bit of an insight from the perspective of a doctor. She's a dermatologist and also an anesthetist. And finally, we also get a chance to hear a bit about the patient perspective. I think we've all been affected by the challenge of the big C. This is cancer. We probably all know a friend, a relative, a loved one, or we've even seen a post sometimes online about someone who's been affected. But today we actually get the privilege of sitting down with an amazing person who's currently going through the journey and fighting through breast cancer. We get to delve a bit more deeper and get some insights into her own journey and how she's actually dealt with the system, the medication, how she detected it, and we'll hear a bit more. So we're joined today by Sihle Nyati Mkondo. So currently, cancer is just a leading problem across the globe, whether it's developed countries or developing countries. I think sadly, everyone is struggling with one of these major non-communicable diseases. So we're finding that it's a big challenge in the sector. We're also finding challenges in how to treat it. We're also finding major challenges in terms of making sure that the cases are captured early and caught early. So hopefully by trying to bring more awareness and trying to discuss more and bring a panel of speakers and also share a couple of patient stories, we also hope that we can get more insight and talk a bit more about cancer amongst our own community. So join us right now as we discuss with Sihle as she takes us through the journey and the process of how she even discovered she had cancer, the treatment, the diagnosis, and everything that she went through. Over to you, Sihle.
Hi, my name is Sihle. So you know your life matters. Why do I say your life matters? Your life matters because if you were like me in 2017 and you were told that you had breast cancer, what would you do? When I discovered that I had breast cancer, I immediately started to consult with the doctors. I was keen, I researched. I became boring to people who didn't know what was going on because all I did was ask about breast cancer until I found out that there were types. So having found out that there were types and that I was having an aggressive one, I should have panicked and died, but I'm a mother of 3. I have 3 awesome children who are growing up, who are teenagers and early 20s, and I would like to see the grandchildren from the youngest. I'm mom, I want to be grandma. And because of that, I took my treatment seriously. I changed my diet according to what I was told, according to the research that I found, according to other, how can I say it? Those who are so much into health, we call them health fanatics. According to health fanatics, I changed my diet, I changed my lifestyle, and COVID came, and all of a sudden everyone thinks their life is important. We are all getting screened. You cannot get into any shop without being screened. Who's screening for cancer? And when? We're all waiting for October. It doesn't have to be like that. You can screen yourself whenever you feel like it. You need to engage and find out how it's done and what is required next. Because if you don't, your life will end prematurely, not because you wanted it to, because no one chooses cancer. But you don't have to wear your pain. You can wear a smile instead and live a very fruitful life with the scars on your body, with the scars that are deep, with the scars that come from the medication that you receive. But you can have a fulfilled life with the right attitude and knowing what matters most.
Thank you, Sihle, for, I think, sharing with everyone. I think that was a very amazing story and I think quite heartfelt and always, I think, a tough story to hear. But I think many of us who've also experienced, whether it's family, friends, or loved ones, who've gone and battled through cancer and also understand the journey. Yeah, it's always amazing when you hear about some of these successes when people are battling through cancer and manage to actually stay as positive as you throughout such a tough journey. But thank you very much for sharing that information. So we'll start off with you, Dr. Nyabawa. We would love to hear a bit more about your journey, your experience, and a bit of your background when it comes to cancer in Zimbabwe.
Hello, my name is Dr. Anna Mary Nyakabawu. I'm a clinical oncologist who works in the public sector, and I also do private practice, and I'm very interested in public health. And additionally, I did some training in palliative care as well. And this helps me to be able to actually deal with cancer through all of these channels.
So thank you for that introduction, Dr. Nyabawa. Yeah, I think quite a number of healthcare professionals and patients do know your name. So can you just tell us a bit more about cancer itself? What are the causes?
Cancer is not just one disease. It is a group of more than 200 diseases characterized by a disorder at the level of the cell. Cancer is an outcome of a disease process which takes a very long time, probably 10 or more years. Our bodies are made up of cells, just like a house is built from bricks. And usually these cells, they grow in an orderly manner. They are well organized, and their control is in the genetic material in terms of the growth of the cells. If there is an abnormality in the genetic material, maybe it's inherited or it's acquired, and this can lead to abnormal growth of cells. And this abnormal growth of cells is uncontrolled, and triggers to this can either be the inherited genes or environmental factors. Environmental factors can include dietary factors. If in your diet there is something that is wrong, that can eventually lead to genetic damage, or radiation, if there is radiation damage to the genes, or infections. In fact, infections are a very important cause of cancer, particularly in developing countries. This is one of the things that I would really like to dwell on, in the sense that, we are very pro managing HIV conditions, and we actually have managed to control HIV in sub-Saharan Africa. But unfortunately, the patients whose HIV has been controlled, a lot of them will eventually develop cancer and die of their cancer. So the time is now for us to really look at the disease called cancer more seriously. I mean, yes, we've been looking at it seriously, but perhaps awareness was not as much as the infectious diseases. In developing countries, we've had more problems, in the sense that, infections are more dramatic, and we usually tend to managing those infections, because also, if you look at, for example, COVID, it's infectious. So people will tend to spend more resources on that. Chronic diseases like cancer, diabetes, hypertension, because they kill the patient slowly, they tend to be sidelined, unfortunately. But in future, as we go towards 2020 or 2030, the unfortunate thing is that more people are going to be dying of non-communicable diseases, and the time is now to pay more attention to non-communicable diseases such as cancer. How is cancer diagnosed, or how does cancer present? Cancer can present as a lump, or it can present with changes maybe in digestion, if someone is unable to swallow their food properly, or alteration in bowel habits. If you get bleeding from an organ, uncontrolled bleeding, it can herald cancer disease. Also, you can get lumps in a part of an area like the breast. I mean, right now we're talking about breast cancer awareness in October. So breast cancer can present as a lump, which has been there for some time, and sometimes it can present as skin changes, or it can present as lumps in the armpit. Sometimes some patients can actually have an inverted nipple, which is something that is new. So what is encouraged to patients is to check for new things that were not there before. So the cell is triggered and you get damage to the cell, and what happens is that the cell will grow at an uncontrolled rate. I mean, otherwise the cell has lost the rule of law. It produces similar cells of its own, and then it produces like a lump. It also, because it is this cell that is aberrant, it doesn't listen to the instructions of the body. It squashes cells that are around it and cause damage to structures, even like the blood vessels or the lymphatic vessels. And then sometimes some of the cells can then squeeze through the bloodstream or through the lymphatic vessels to spread to nearby structures. If it is like the breast, it can go to the armpits. And then other areas where the cancer can spread include the lungs or the liver or the bones. When this cancer has spread from where it started, like the breast, actually, by the way, the cancer is named by where it starts. When it spreads to other parts of the body, it is still called breast cancer, which has spread to the lungs. What gives rise to the symptoms is if the cancer continues to grow. Say if it is in the lungs, the tissue that has come from the breast will produce tissue in the lungs, and this tissue does not breathe. And if there is so much of this tissue, because it continues to grow, then it will actually cause shortness of breath. And if this tissue is in the bones, it is soft tissue which is not as strong as bone. It will cause breakage of the bones, and also sometimes it can even cause pain, because the tissue that is in the bones will trigger pain, nerve endings, and someone can present with pain. So these are called metastases, which are areas of cancer spread that are far from where the cancer started. We aim to have someone prevent cancer because it's cost effective to prevent cancer, either through your diet, avoiding radiation like the sunlight. These are all things that can be looked into so that you avoid developing cancer. By the way, the issue of cancer is relevant to everyone, and prevention for all. If we are unable to prevent the cancer, we want to catch it when it is still very, very early. And how do we catch it when it is still very early? There are some cancers that are amenable to screening. Amongst them are cervical cancer, which can be screened using, in our setup, VIAC, which is visual inspection using acetic acid. Is the most cost-effective or the cheapest way if we want to screen a large population. And then the pap smear, which is a smear of the area that is usually abnormal or which is thought to be the origin of cervical cancer, and then we take the specimen is fixed and taken to a specialist doctor to read. The specialist doctor is called a pathologist. This is the doctor who makes the diagnosis of cancer because they look at the appearance of the cells. They are specialized to be able to tell that this is a normal cell and this is an abnormal cell. So we have talked about screening. Cervical cancer screening is the one that is classic and is very relevant to our environment. Prevention is also relevant. There are ways of preventing cervical cancer. The cause of cervical cancer is human papilloma virus, and we do have a vaccine called human papilloma virus vaccine, which is given to children of about 10 years in our environment. And as we speak, actually, young girls are being vaccinated in Zimbabwe. So there is an ongoing vaccination program for human papilloma virus to prevent cervical cancer. But when you vaccinate a child today, you prevent cancer in the next 20 to 30 years. Whereas screening is effective now, because if you see any lesions on the cervix, they can either be fixed, they can either be frozen, or you can actually hit the lesion, or sometimes they can be removed by a gynecologist. So you can actually see and then treat any lesions. The outcome of cancer causation, usually when it comes to cervical cancer, it's only the minority of the patients that eventually develop cervical cancer, which means we have a large window of opportunity to prevent and early detect cervical cancer before it is advanced. By the time someone presents with cervical cancer, which is established, or invasive cervical cancer, it may be 10 years from the time that they started having the process which they could not feel. In fact, when we talk about the symptoms of cervical cancer, one of the symptoms is no symptoms at all. And then some of the other symptoms include bleeding after a man and a woman have been intimate. Symptoms like backache can also occur. Bleeding, I've talked about bleeding, okay. Women can also present with an offensive discharge. Unfortunately, when these women present to the primary health care providers, this can be diagnosed as sexually transmitted infection. And unfortunately, a lot of our women when they get treated, sometimes they don't go to the same doctor. And if they go to a different doctor, they'll treat them as a sexually transmitted infection again. And yet sometimes if it's the same people that have been treating, when they realize that, this woman has been coming for a long time for treatment of sexually transmitted infection, they will end up investigating them, and in such a case make a diagnosis of cancer. And this diagnosis is made through taking some tissue from the abnormal area and sending it to the doctor for investigation. Once a diagnosis of cancer has been made, they need to be referred to institutions where there is a specialist who treats cancer. Depending on how far gone the disease is, when we say how far gone is the disease, we find out through what we call staging investigations. Staging investigations can include talking to the patient, that is history, and then examining the patient. We can feel how far gone the disease is, and then also doing tests such as blood tests and also x-rays, which can show us how far gone the cancer is. X-rays can actually see what the clinician does not see. So, and that helps us to see the disease that may have spread at an earlier stage. Once the diagnosis has been made and the staging has been done, we then plan the patient for treatment. And there are various ways of treating cancer. The earlier the disease, the simpler the treatments can be. And also, early stage disease can be treated with one modality. More advanced stage disease is more difficult to treat, and sometimes we may need more than one modality to treat, and this adds to the cost of the treatment. And unfortunately, later stage disease or advanced stage disease, the results of treatment are far less satisfying than treatment of early stage disease. If I look at, say, the stages of breast cancer, if it's stage 1, you can actually treat or cure, or can treat more than 80% of the patients. When it's stage 2, it can be slightly less, maybe 70%. And then stage 3, the cure rate is less. It's not just the stage of the disease that may determine whether someone can be curable or not. We also need to look at factors like, does this patient have other diseases as well? Is this patient well nourished? Because nutrition is important when it comes to treating our patients, because the immune system needs to be fed so that it fights the disease as well.
Yeah, so thank you so much for giving us a broad insight about cancer in general. I think right now, since it's Breast Cancer Awareness Month, let's actually focus specifically on breast cancer. So, would like to hear maybe from Dr. Mashawe first. Can you give us some insight into a bit more about, say, breast cancer, how women can actually examine themselves and check themselves that are they at risk, or is there something wrong, or do they need to go to the doctor?
Hi everyone, my name is Dr. Valerie Mashawe, and I'm a medical doctor with an MSc in clinical dermatology. As we all know, October is a Breast Cancer Awareness Month. And according to the World Health Organization, we have approximately 268,000 new cases yearly of breast cancer cases. And around 62,000 people die of this disease annually. Unfortunately, the lack of awareness has made early diagnosis such an uphill task for most of us. So today, I would like to talk about a few things that one needs to do to recognize this condition early for early treatment. So this is very important to know the breast cancer awareness 5-point code, which is as follows. Number 1, know you're normal. That's the first thing that you need to know. You need to know the morphology of your breast, how it feels like, how it looks like, for you to be able to know any changes if they do come. Number 2, get into a habit of looking and feeling your own breasts. Number 3, you need to know the changes to look out for. Then number 4, when you know the changes, go to your medical practitioner as early as possible. Then the last one is, if you are 50 years or 40 years and above, you need to constantly get checked. You need regular checkups to see if you have any changes that you may not be able to recognize on your own. So you may ask, what should I look for to know if I'm at risk of breast cancer? And I think what has been talked about the most is the symptom of having a lump in the breast. But I also want to highlight some of the symptoms that I've seen in the dermatological clinic that are often overlooked when diagnosing breast cancer. Okay, this is number one. You need to check if there are any changes to your skin above the breast. Is the skin the same size, or there is a prominent part on your breast that you cannot explain? Is it red? Is it hot? Is the nipple discharging anything? Or is the skin flaking or inflamed, which may be confused with eczema most of the time? So when you see those changes, you need to go to your medical doctor for checkup. Do not just ignore such symptoms. Then, of course, the lump that everyone knows. You need to feel your breast and know the morphology so that you know if this lump is abnormal or not.
When there is a lump that is suspicious, for a diagnosis of breast cancer to be made, they need to go and see a clinician or a healthcare worker, and then they can have some tissue taken from the abnormal area, and that tissue is sent for examination so that a diagnosis is made. And that is the hallmark of diagnosing cancer. Without a pathology report, it's not possible to make a diagnosis of cancer. And once a diagnosis is made, the patient can be referred to oncologists for treatment. Oncologists can either be surgeons who can operate, or they can be doctors who treat with either chemotherapy, which is using chemicals to treat the cancer, or hormone treatment, which is using anti-estrogens. Like an example is tamoxifen, to block the receptors, because when a cancer is estrogen sensitive, it means there are some receptors on the cancer, or keyholes on the cancer, which are stimulated by the estrogens, and the tamoxifen goes and blocks those keyholes so that it slows down the growth of cancer and makes someone be able to live. Even someone with advanced disease, the cancer will be slowed down and they can live a meaningful, purposeful life. This treatment is actually also used after the patient has had cancer removed to cater for any possibly remaining cells that may be lingering in the body, so that they are weakened such that they don't continue to grow and the patient can live a normal life. There is life after a breast cancer diagnosis. I've had patients who live even with cancer that is spread to other parts of the body for years, 5, 10, and even some 20 years. And they're actually living fulfilled lives. With all the new developments, there are new medicines that are up and coming, and some patients are actually being treated with different kinds of treatments when they recur, such that you can actually eventually make cancer a chronic disease through using different kinds of treatments. Now there are other new treatments such as immunotherapies, targeted therapies, The major problem in our environment is access, and I think this needs many stakeholders to come together and plan and see how we can make cancer treatment more accessible to our patients. Whilst we are planning, we should actually engage cancer survivors because they have been through it and they are the ones who can help us get things better for the cancer patients.
So we've got the different cases, cancer that's affecting men. Then we've also got the cancers that are affecting women. Some actually overlap, like Kaposi sarcoma, because of our HIV prevalence here. But what I would like to just unpack a bit more is that, is there a way that one can prevent cancer? So specifically, given that we're focusing on women, let's just talk about that. Is there a way that they can actually prevent cancer?
Obesity is one of the risk factors. Substance abuse is taking alcohol, smoking, and reproductive and hormonal imbalance. Then also infertility, unfortunately, or women who give birth at a later stage, or those who give who have menopause at a very late stage. So those are some of the things that you also need to understand, that they are the risk factors. Then there's also a component, a genetic component to it. If a family member has had breast cancer, you also need to regularly check yourself to find out if you're not at risk of this disease. Okay, so how can we reduce the risk factors? Okay, number one, according to research, diet plays a major role in reducing the risk of getting breast cancer. You want to include a lot of vegetables in your diet, especially the cruciferous type of vegetables. I'm talking about the cabbage, kale, your broccoli, your cauliflower, etc. And also you want to cut down on your sugar. Then we also have exercise. As simple as it may sound, exercise does reduce the risk of getting breast cancer. Then one other thing that women need to know is breastfeeding is actually very important. You need to breastfeed your child. You can actually reduce the risk of getting breast cancer by about 40%. Then also not exposing yourself to environmental pollutants or applying anything that you get your hands on your skin. That's one of the reasons that I would say from a dermatological perspective, you need to be aware of. You need to be as natural as you can so that you curb the risks of getting breast cancer.
Other factors that come in terms of whether you can cure the patient or not is availability of treatment. It's always important to make sure that the various treatments that are recommended for the disease and the extent of the disease are available. And this is something that everyone should work on in terms of access, the health funders, the health institutions, society as a whole. If we all come together to make sure that we assist each other to make the resources available, there is no one person who can avail everything, because cancer is a complex disease to treat, and the treatments are very expensive, and there is need for collaborative efforts to make sure that we make the treatment available for each and every one of us. And we should not think that because I don't have cancer, I shouldn't worry about it. We encourage people to think in a way that tomorrow it is me, today it is so and so. And we make sure that we help the institutions to make sure that there are machines for radiotherapy for the patients, chemotherapy. We want to make sure that patients get access to treatment by making sure that the medications are available at an affordable price. At the moment, the cost of medications, because they are imported, is very high. And there is a lot that needs to be done by various stakeholders so that they can sit down and we make sure that we try and see that we reduce the prices of chemotherapy particularly in the public institutions.
I think the month of October highlights a lot and brings a lot closer to home. I think this month I've seen a lot more awareness that is going on, whether it's internationally and locally. Locally, I've seen a lot more bodies that are present and a lot more activity that is going on, even through social media, through even the conversation. And we're hoping that eventually things like cancer can get demystified. I think the struggle and the journey in the healthcare sector has been similar and the same, even when we look at HIV. Early days of HIV, there was a lot of stigma associated. The awareness was very difficult and people didn't seem to understand it. Now look at us 10 years later, or 20 years later. You're finding a lot more people surviving. You're finding that there's medication that's there and it's accessible. You're finding that there are also more doctors that are also present and even more healthcare professionals that are present in order to support and help. And I think as a community, we all need to work together so that we can also support each and every one of our population that's actually struggling with the fight when it comes to cancer. I think we can definitely all play our part and our role. I think sadly, 1 month is never enough when it comes to discussing breast cancer. I think this is a continuous conversation that we always need to continue to have in our communities. And I hope that we can continue the torch burning. Yeah. So thank you so much to everyone, I think, for joining us. Our panelists, I think they've highlighted some amazing information. And I think to everyone who sat and also watched, thank you very much. We'll also take a lot of the comments into consideration, so you can always post any of your comments and information. And I think a big thank you right now and wishing all the best to Sihle, I think, during her journey as she battles breast cancer.